The wellness of Beaverton, Oregon is at risk. Key indicators show a growing disparity among our citizens. 13% of children are living in poverty, 37% of residents are overweight, 23% are obese, and 12% of the community cannot see a doctor due to cost. The BCHC, or Beaverton Community Health Collaborative, creates a transformative model of care. By bringing together cross-sector services such as primary care, behavioral health, and social services in one facility, the most vulnerable members of the community will gain unparalleled access to the services they need to lead healthier, more productive lives.
The BCHC model is so important to Beaverton and really to the rest of the nation because it's a novel concept about co-locating physical health, mental health, vision and dental, along with all the essential social services that provide the safety net that so many people need.
Recognizing that healthcare is broader than the clinical exam space, addressing social determinants of health, we've got our best shot at affecting population health because we can reach beyond just the clinical care and get to total care.
The services provided by the Beaverton Community Health Collaborative will include primary, women's, behavioral, and elder care, as well as social services such as rent assistance, counseling for drug addiction, and workforce training. All of the partners agree. Prevention is key to improving the health and economic future of Beaverton area citizens, and an integrated health and wellness facility will lead to significant social change.
As we think about promoting health rather than fixing illness, we have to think about making sure those social determinants of health are met.
Many factors such as poverty, race, nutrition, and the physical environment all play a role in the community's wellness. In the Beaverton area, an integrated comprehensive healthcare access point would help to solve a puzzling array of problems. The BCHC will adhere to the triple aim by providing access to quality care, improving the patient experience, and keeping the cost of services low. For the first time in Beaverton, the medically underserved will gain access to the health and social services they need, all in one convenient location. Changing the focus from sick care to well care will improve the quality of life for individuals and ultimately the community as a whole.
Being under one roof would cut down in my expenses. When you're on limited income and you have to go to all these different places, it adds up by the end of the month, and sometimes I just don't have money for anything that I really need.
If we can address their basic needs, we know that their health conditions right there are going to improve. This is unique for us because this isn't just a partnership and it's not just a co-location of services. It's really understanding that the families that we're serving desperately need to receive comprehensive services and a continuity of care.
The integrated model at the BCHC will really provide an opportunity to not only make a referral to another organization, but to literally do a warm handoff to the other organization that will be co-located and integrated within the facility.
This is the way we have to provide healthcare, but most importantly, and this is the real key, is the outcomes. The win for the community here is tremendous.
Our role is to oversee the clinical education component of the Beaverton Community Health Collaborative. So we hope to embed our students in an active clinical practice in which we extend the formal learning that they've received in team-based, patient-centered, interprofessional care.
To be able to have a team meeting where I could sit down with the social workers and the people who know about all the rent assistance programs and the Head Start programs and the job retraining programs so that we could talk about our patients as whole people and really help get them to the place of self-sufficiency where they can actually help themselves be healthy. I can't even begin to tell you how exciting that is to me.
The goal would be that we're getting the maximum utilization out of all of these spaces throughout the day, into the evenings, and even across the weekends, by scheduling them in a cross-functional way across these different partners. By doing that, we can be a lot more effective in terms of controlling cost, increasing value, and hopefully having people that are much healthier and able to engage more productively and socially in their communities.
So in 2014, the Oregon legislature voted that we would approve $1 million in bonding to support the BCHC, assuming that the rest of the funds were raised.
We need local and regional health care and health education providers, mission-driven foundations and businesses like yours to join us in making the BCHC facility a reality. Together we can make a profound impact on our community, creating a model of care delivery worthy of emulation across the nation.
We have such incredible partners. To me, the partnership is almost as exciting as the work we will do to better improve health for our clients, because there's just so many aspects to it that will make the whole person's health better.
Beyond a building, this is a way to improve a community's overall wellness.
What's very important to me is a doctor that listens to me.
This is what we're doing in Oregon. This is what you too could be doing to change how people live in your state, to help get people healthy.
It has to help people.
There's a whole team there that is there just for me.
We are providing services in a holistic way so that they are truly transformational services for the families who walk through the door.
When I look back over my career, 20, 30 years from now, I'm going to try to think about what the defining moments were. I think that the work we're doing with BCHC is going to be one of those defining moments.